transmitted infection, or it's an infection that is transmitted through sexual contact or through body fluids that can be either through sexual intercourse or through contact with a person.
Doctor, how do you mean a contact with a person? If I sleep with this person, because these days we have condoms, you know, and I love the way, you know, Uganda Cares does, you know, preaching out the use of condom in young people. Can I still get it when I use a condom?
No, a condom is one of the preventive tools that can prevent you from getting an STI. So you normally get it from when you don't use a protection.
Wow.
When you're in a risk behavior aspect, like unprotected sex, okay? Or you don't use, during a condom, you may use a condom, but during the removal of the condom, even those body fluids, if they're infected, they can get you. So it is also during, you have to know what we call effective use of a condom so that you don't get an STI.
Okay, now doctor, someone out there would want to know what are some of the common, you know, symptoms of STIs, because when we went, before we came on air, you told me an STI can lead to an STD. So you want to tell me an STI is, you know, something that, let's say I have a fever before you treat it, and then by the time you go to hospital, say, hey, but now you're very, very sick, you have malaria plus 2. Is STIs, you said at one point lead to an STD. How does that happen?
When you don't treat STIs, because these are infections that are caused by different organisms. We have some which are caused by bacteria, okay? These are more medical terms. So we have STIs that are caused by bacteria. We have STIs that are caused by a virus. We have STIs that are caused by a parasite. So these, all of them can give you signs and symptoms that we, the medical people, the health workers, can judge and use to make a diagnosis, okay? So some of the symptoms, some STIs can give what we call immediate symptoms. Others may take some time to give the symptoms. So you may find that some of the people harbor an STI for quite some time.
Like how long, doctor?
It depends on genetic makeup of someone and the what do you call the duration and the severity of the infection. But one of the common symptoms of an STI is a discharge, both in males and females,
in females.
Okay? So a discharge is one of the commonest symptoms of an STI, okay? Before you move into other symptoms. So as long as some of the people, especially the females, can see a discharge, it's an indicator there's something wrong with me, that I need a medical attention, okay? And when we look at it globally, we think, because some of the statistics we have that around 1 million people acquire an STI on an annual basis. Wow. Which is on a daily basis, 1 million people, over 1 million people acquiring an STI on a daily basis. That is really a very big global burden, okay? Then at some point they were telling us around 340 new infections of the key 4. You know, we have different STIs, causative agents, but there are key 4 ones which we have. I think we shall discuss about them later. Those were new irresponsible, like chlamydia, we have gonorrhea, we have syphilis, and then the vaginal candidiasis, especially trichomonas, basically affecting the women. So these are one of the leading causes of STIs, those 4 organisms.
But doctor, they say by the time you get gonorrhea, it must have been in your body for some time. And I keep on asking myself, if I have it and I sleep with my partner, is there a possible way that my partner will get it?
Yeah, if you have unprotected sex with your partner, women have a benefit of gonorrhea because for them they can harbor the causative organ for quite some time without showing the symptoms. Whereas men, as soon as you get it, you show the symptoms. So a woman can harbor the gonorrhea bacilli for quite some time compared to men. Men's symptoms really come out very fast compared to women. So if I sleep with you and you have it, By tomorrow, I'll show the sign as a man. Yet for you, the woman, you may not.
You might even not show
You
any.
not show any sign, but it has what we call further advanced complications on the woman.
Exactly, that's what I wanted us to go to.
Yeah.
In just in case I don't know that I have it, and you know, it keeps on growing and growing. What can it lead to in a woman?
There are so many complications of gonorrhea in females. One, we have what we call PID.
Yes, PID.
It's one of the commonest complications of gonorrhea. Then we have what we call, it can cause, during birth, if you get pregnant, then you can transmit it to your baby,
to the unborn baby.
Yeah, fine. Then to cause more of the eyes, in the simple terms. If you don't treat it, it can cause blindness.
What? To the baby?
To the baby. So that's another big complication of gonorrhea in females. Yeah.
Doctor, something that is so funny that you've talked about. Can I get gonorrhea from a toilet? Because I know, me as a woman, I can get, you know, the candida and, you know, the funny infections through the toilets that we use. Is it possible for me to get gonorrhea from a toilet? Let's say if another woman has used that toilet and doesn't flush, and I come and I'm also, you know, dying of pee, and I also use the same toilet, is there a possibility for me to get it?
Because if that's a body fluid, from a woman. If you get into contact with it, then you get it. You get me? But does not mean that gonorrhea can harbor within the toilet. That's why I'm saying that if at any chance you get into contact with a body fluid that has gonorrhea, bacilli, you get it.
Let's talk about candida, because you talked about 4 of them, and you know, candida is one of the major. Would we call it an STIs in the women? Because, you know, sometimes even the babies get it. Because I didn't know that also babies can get infections, you know, urine infections. And when you talk about candida, how can one get candida, and how can one prevent it in case one has gotten it? Because sometimes they say it's an itch. Someone can itch and itch and itch. And then, you know, when you go to people that do not understand this, they will tell you that's a fungal infection. And you ask yourself, a fungal infection from where? And how did I get about it? How do we go about that? Just in case, you know, a lady gets that. And how is it gotten? Maybe for the people out there to get to know more about it.
When I'm to explain candida, how candida comes into what we call the female genitalia, because those are the people who are most 95% are the ones affected by the candida.
Yes.
A woman's vaginal wall or vaginal aspect has what we call yeast cells.
Yes.
Those ones are natural. Every woman has these cells. So
do babies also have them, baby girls?
Yeah, at some point, every woman should have these cells.
Right.
They are what you call they are protective cells for a woman. But if they reach a threshold and then they're above that threshold, that's when they turn into a problem. So there are things that make you have your yeast cells of a woman grow more than where they should be. So we look at when the woman is trying to, the conditions that really relate to that. For example, when the woman is towards her messes,
yes,
or in her messes, your yeast cells grow more than where they should be. And the outcome of yeast cells is what causes the candida. So to me, a woman having candida is not that she has had a sexually transmitted infection. It is sometimes because of a hormonal disturbance, the temperature, the vaginal pH, if it goes below what it is required, if it turns into what we call a basic media, then your candida outcome will be more than the threshold. So it's not more of a sexually transmitted infection. It can be caused by your hormone disturbance. It can, even when you're stressed, when sometimes the lotions women use to wash down.
Yes, I was actually about to ask you, doctor.
Those are things which normally cause it.
Because we have a lot of feminine washes that I've seen that they're advertising. Very many. Some of them there are pills when you go into supermarkets that they're selling that take this just in case, you want to have sex and your man, feels, nice, something like that. And then there are these other feminine washes that you buy and you look at it. But I wouldn't say that I, for one, have used them. What are the causes? Are we supposed to use those feminine washes?
Some are
Are there
proven.
some that you recommend for women?
There are things that are more, I want to say it in this manner, because we're into what we call the global marketing world, where people have very many
the tech world.
The tech world, very many developments are coming on board. But I'll urge you, the females who are there, that before you use any of such materials, you should get what we call a health worker's opinion advice, so that you really pick it up. That's how I would broadly answer it. I will not say this is good,
this is bad.
I'll just say if you want to use one, get a health worker's opinion, approval, so that you start using them.
Doctor, okay, please continue.
But there are some that we have, I will not say because it will be like marketing for some sample, but there are some that we have seen that they have put an impact, especially what we call on the pH of the vagina. Okay, so when you moderate the pH of the vagina, that is, you'll be able to limit the frequency of the infections of that lady. So some of them work within the pH of the vagina wall, keeping it acidic. Okay,
sometimes I see ladies when we go to the bathrooms, there are sprays that they spray to, kill the infections in toilets. Are we also supposed to use such kind of spray?
Yes, it's okay, because those are more of bactericides. If they can kill the infections, it's okay. That's part of toilet hygiene. And females have, because of the vagina wall is
so sensitive,
and it's when you look at the vagina, I will not describe it here, but it is prone to infections if you don't have good hygiene.
I wish we would have some pictures next time, Doctor. When we'll have a look at these pictures. Doctor, someone watching us, I've just gotten a message. Someone here, she's called Brenda. She has told me if you could kindly ask the doctor, what are the symptoms of STIs? Do I have a fever? Do I get a headache? Do I feel a backache? What are some of the symptoms?
One of the symptoms which I told you, common is the head discharge, either through the vaginal wall or through the urethral wall. So a discharge either through a manis, penile, urethral wall, or through a vagina, that's one of the commonest symptoms of an STI. Then you can move further to elaborate other symptoms. For example, you can have a backache.
Is it a severe one? Is it a concurrency one?
It depends on the severity of the condition. It can be mild, it can be severe, depending on how long you have stayed with the infection. So you can even have what you call painful sexual intercourse. Okay, that is to say, when you're having sex should be enjoyable, but when you start feeling pain, that's a sign of an STI that you have to move in. Then let me explain this in terms of the opposite organs. You have STIs that are caused by the different. Let me give you the common STI we have which is now the global burden, which is HIV. So HIV as a stake, where AHF is more specialized. As a stake is an STI that has a variety of symptoms, because you have the grading of the stagings of the patient, how the patient will come in the fever. Some people have episodes, some will have what we call a diarrhea, some will get a headache, so a severe headache. So depending on how a patient presents. So HIV is an infection that has multiple symptoms that you can buy. Then you can have another infection, syphilis, as also its signs and symptoms. Then we have gonorrhea has its signs and symptoms. Then you look at the vaginal discharges I talked about. We have hepatitis B, which is also a sexual transmitted.
Doctor, can't I get hepatitis B through water when I go for swimming?
No, you can't. It's a body fluid that you have to get. So it's through blood. Water is not.
It's not blood.
It's not blood.
Yes.
So you have HPV virus, which attacks more in females, and that is one of the leading cause of cancer, cervical cancer.
Yes.
So that's an STI that women don't really perceive it. So all those give you different types of symptoms. When you look at HPV, The commonest of it is you have painful sexual intercourse. Okay, we look at hepatitis B. You have the yellowing of the eyes,
the fever, the sweating,
the fatigue. So those are most of it. But the key point here is that an STI is, at least which I urge everybody to watch up, is a discharge.
A discharge. Doctor, I've talked about, hepatitis, right?
Yeah.
And hepatitis is one of, sometime, I think even way before COVID, they said people that had gotten vaccinated with hepatitis B, some drugs and some hospitals were not approved. Let's talk about these vaccines of hepatitis B a little bit. For how long am I supposed to get, a vaccine of hepatitis B? And in case I go into sexual contact, can I get it after the vaccine, or I still have to watch out myself?
Yeah, I think vaccines protect you from acquiring a disease, but does not mean that you increase the exposures to those infections. That's the key point we should know. However much I may be vaccinated for hepatitis B, I should still take caution
about it.
But wear the protective gloves when you're going to handle a patient, do the screening of a patient, because this is something that can't get even if you are protected.
Wow. Oh, wow. Well, this morning, once again, I'm honored and delighted to have Dr. Haruna, and he's from Uganda Cares. He's talking to us and explaining to us about STIs. And I told you before we got on air, the doctor talked about, that an STI is something that can be treated, but he's going to tell us how we can treat it. And also he said if it is not treated early, it can lead to an STD. So we have a lot to ask the doctor, and we have a lot to engage the doctor, just in case we do not answer all your questions and your questions are, are not finished. We'll still have Dr. Haruna next Saturday to come and complete these questions. Doctor, something that you talked about is getting tested. Should I get tested for STIs, and how often should I do that? In case I want to know where I'm standing, what is my fate? I don't want to, to get to a worse condition, that, to getting into STDs. How often should I get tested to know how my fate is?
Yeah, for example, I want to answer in terms of the the wellness clinics of Uganda Cares. We have three wellness clinics so far. We have one at Chitante, a wellness clinic that is along Kamocha. We have one at Kalungu, that is Rukaya. Then we have one at St. Barakudembe, that is the market aspect. So these are the conditions. When we talk about STIs and how long we should try to test, one of the things that I urge everybody is if you have never screened for an STI, at least do it once in a year. At least do it once in a year. And the approach is, there are what we call risk behaviors of different people. The higher your risk behavior, then the higher the chances of you getting an STI. So the shorter the duration for you to keep screening and checking for STI. For example, when HIV, at least once, if you're a married couple and you trust something,
you have trust issues,
then at least you should have an HIV test once annually. Yeah, okay. But if you're in a risky behavior, like let me say
prostitution,
commercial sexual worker, then at least between 3 to 6 months you should every time go for an HIV test, okay? So, and if you're in a risk behavior, let me say, men who have sex with men.
You sleep here, you jump from one man to another.
Wow. So those ones also should have, I think, between 3 to 6. Okay. Then I'm not saying Muslims who have multiple sexual partners. Those Muslims don't have multiple sexual partners.
Yes.
They have married partners.
Yes, those ones are approved.
Those ones are approved.
Yes, like you have my 3 wives and they are approved.
That's okay. So that one doesn't necessitate a husband to take every 3 months or 6. But if is a culprit of somebody who has multiple sexual partners, then at least 3 to 6 weeks. I think between 3 to 6 months you should have a test for that.
So that you can get to know where you stand.
You should get to know. And for the other STIs, everybody I think should have a screening because it is good to screen and test so that you know where you're standing.
At what age is one supposed to screen? Because me, I have a 5-year-old. Can I take also this 5-year-old to be screened?
Because I'll answer it in terms of the statistics. So we look at the ages between 15 to 49 years. Those are ages that are really sexually active. So those are the age I'm talking about. But the ages below, I don't recommend it.
All right.
Although these days we're having one of the interventions for the young girls is to have HPV vaccination at least 10 years.
10 years. So these young ones, 5 years, no, they don't need the vaccine. But can I have that vaccine at my age?
And that is if you have never had a sexual intercourse. That is the entry point, the criteria.
Dr. Haruna,
but if you have ever had that,
yes,
then we don't recommend.
We don't recommend that. Now, Doctor, at Uganda Cares, before I go to the next questions that I wanted to ask, at Uganda Cares, can we come and get this treatment? Can we walk in and get checked by a physician or by any doctor there?
Yeah,
Do we have a fee that we are supposed to pay?
Now, all services at the wellness clinics are free of charge. You just have to walk in. We have already qualified staffs. 24, I think we work between 8 to 5 p.m., between 8 a.m. and 5 p.m., Monday to Friday. Okay? So all services are free. You just come in at any time you feel like. And you do a test, and then they'll give you all the tests. They will work on you on the test, because wellness clinics are made in a way to promote and protect and prevent and protect people from such diseases. So we do all types of tests that we really are within the mandate. We can really test for a patient. For example, HIV is one of it. We do syphilis, we do gonorrhea, chlamydia, and other STDs that we do. We do screen all of them. Hepatitis B, although at another level.
Okay. All right, now, Doctor.
Then lastly, we offer treatment after getting you diagnosing with an STI. We offer a treatment free of charge. You don't need to pay. Free of charge. All services of AHF are free of charge. You don't pay.
Guys, if you're watching us, please just go to Uganda Cares. When you reach there, ask for Dr. Runa. But I told you, when you go there, go knowing he's going to first give you just by the time they check you and the result come back, your heart is at stake. I think he's one of the doctors who wouldn't tell you, for you are sick, you have HIV, you are going to die today. Because the way we were here, joking and laughing, it seemed like people would want to come just to see who is this doctor who is giving us jazz. Now, doctor, what are the treatments? What are the treatment options for the different STIs? Let's say if I have an STI, what could be, the treatment for the different STIs that we mentioned?
Okay, if you look at what you call Ministry of Health guidelines, that's where I'm going to reason it in terms. We have what you call syndromic approach to diagnose an STI. Then we have what we call etiology, where they take your sample to the lab, and then they really actually analyze your blood or your swab, vaginal fluid, then they tell you. So the syndromic approach, you normally use the signs and symptoms. You come, you tell me your symptoms, then it is from that packaging that a doctor or a health worker will give you the treatment, okay? Then all treatments depend on the causative agent. If it's bacterial, they give you
treatment for that.
If it is viral, like let me give you HIV, you start treatment of HIV. Okay. If it is parasitical, then they'll give you. So it depends on that. But then we have specific guidelines for the bacterial infections. Okay. So all the treatment depends on what is causing the infection. Okay. For example, if you have syphilis, they will give you the betahine penicillin. And nowadays, you don't give it like what you used to give previously. The 3 injections, that much. So it depends on your level, the stage of the syphilis. Then can give you either 1 dose, or if it's a late stage, you give you the 3 doses.
Is it given through IV?
No. Through the IM, intramuscular at the buttocks. Okay.
All right.
So I will not say specifically that all of them STIs have the same treatment, but you treat according to the
symptoms,
the causative agent. For example, virus, if you look at HIV, they will put you on antiretroviral treatment. Okay? If you look at hepatitis B, they will put you on antiretroviral, part of one of the antiretroviral treatment. When you have vaginal candidiasis, they will give you the antifungals. When you have the, let me say, bacterial, when you have gonorrhea, they'll give you the drugs that really give you to that.
Okay.
So it depends on the doctor and then the results that they give.
Can STIs be cured for a lifetime? Can I stand and say that I'm cured? However much I'm going to engage myself in, sexual intercourse, I'll not be able to get it because I treated it. So am I guaranteed that if I treat it, it can heal for a lifetime? It can be cured for a lifetime?
Because we have two types of STI. One that is not curable, that is HIV.
Yes.
Okay.
I think, Doctor, we need another day for you to come in and talk about HIV. I think we need to plan, because I wanted to ask you more about HIV, but now we're talking about this. I wanted to ask you about the vaccines that we have on the, on the market. I think that will be a topic that will be interesting for the next, coming week. Now, can I be cured?
So for the other curable STIs, like gonorrhea, like syphilis, and the rest, those ones you can get treatment and you cure.
But there are those.
But if you get into a risk behavior, you can acquire it. So you're cured, and the argument after being cured after the treatment, you should protect yourself from getting an infection. Okay? Then HIV is one that is not curable.
But doctor, talk about HIV is not cured. We see that sometimes when people go to check and they find that their virus have gone like from up there, sometimes they say they become carriers. Is it true?
Carriers? No, HIV is the basics of HIV treatment is to really have your viral load because these are viral copies. When you have HIV, you have your virus replicating, multiplying in your body. So if you had one, it will replicate and have billions in your body. So when they put you on treatment, that replication stops altogether. Then that viral load starts dropping down. So there's a viral load that we think that is able. That's what we are saying as Minister of Health, that U is equal to U. If we do a viral load test and it is not detected, then you may not. The chances of transmitting to someone are minimal. So that's what, and that's why we want to go to by 2030. That's our aim, that at least by 2030 to have 0 new infections using that component. That if you take your drugs properly and your viral load, you have a viral suppression, then you may have the chances of transmitting it are minimal if you take other avenues constant, okay? But does not mean that all those who have suppressed viral load should engage in risk behaviors because you get an infection of virus.
You can get a new one.
You get it.
Wow.
So the argument is people should take your medication to suppress their viral load. Then we may see a generation where we don't have any infections.
True. All right, doctor, how can I talk to my partner about STIs? I guess I have a partner. How do we, how do I start this conversation that we need we need to get checked up and get to know about STIs? How do I go about it? How do I start the conversation with the partner?
There are two options. I'm just giving from my perspective. There are 2 options you can take. One, you can speak to a health worker to lead you, to guide you on how to share the news to your sexual partner. That is one component. If you think you can't do it yourself. Then the other, that is what to do, your provider initiative. Your health worker leads the discussion to discuss it with your spouse. Then there are issues where you take the initiative to go and then speak to him. So for me, I normally tell people to use what we call the four W's. You with your husband, you have studied him for some good time. So you should. One thing I should tell people who are listening to us is, you should choose a calm, quiet place. So that is when. The first W is when. When do you think your partner will be able to listen to what you're talking to him? For example, you cannot start talking to your partner, in now I'm giving an example. We're in the phases of school fees, where parents are struggling with school
senior
fees.
ones are going back, senior fours.
Senior fours.
A little, we should know that senior six are also exams are going to be coming up. The pressure.
The pressure. So you can't start such a discussion of one STI. To me, that's what I'm thinking. But we had a previous celebration of International Condom Day, which was before Valentine's Day.
Yes, it was.
So Valentine's Day was a very important day to talk to your partner about STI screening and testing. So when do you choose is one of the key points. So you choose the time that you think is appropriate, that your partner will be able to listen, to give you an open ear, and have a discussion. The timing, even timing is very important. For example, I've told you the timing of school fees. So you choose a time that you think your partner is able to listen to you. Okay? Most of the tradition of women, how they speak to their partners is during bedtime. Before you engage into whatever you're going to do, then that's when a woman would speak to you. My husband, before we get into this, but we need an HIV test, we need to go for STI, you get me? So even timing is very important. Okay? 3, how are you going to package? What are you going to tell him? Even packaging the information to talk about it is very important. Okay? So these are things that should be put into consideration. 1, the timing. Choose the best appropriate time that you think your partner will be able to listen to you. When is very important. Where? The place. Is it in a bar? Is it at home when you're relaxed? Is it when you're taking it out? These are things you study. And I think when people move out, like for Valentine, that is a good chance because everybody is able to speak to each other. When they take you out for a dinner, these are times that you should have opportunity to speak to your husbands about this. So the timing and when, it depends on the couple.
All right, now, doctor, do we have vaccines for STIs?
Yeah, there are some STIs that we have vaccines. For example, I talked about the HPV virus.
Yes.
That's an STI that you can have vaccination on HPV, which even the government of Uganda has implemented, okay? Then you have another STI that you have is hepatitis B. You can even have hepatitis B vaccination. So those are the 2 STIs that you think we have vaccine. But HIV don't have a vaccine yet for it.
All right. Well, a friend here has sent me a message and he's asking me that, good morning, Sheila, kindly help me ask the doctors that just in case I walk into a clinic and I get tested, do I have to take my partner to test as well?
Yeah. That's one way, and that's what we're encouraging the population. Even at the wellness clinic, we try as much as possible. If we diagnose an STI, we try as much as possible to make use. Bring your partner for testing. Okay. For example, there is a new component in HIV. I'm just bring this as this, which we call index client testing. Index client testing is more to do with what we call, tell me the sexual contacts you have been with, Sharon, in the last 1 year.
Yes.
Okay?
Yes. I think I did one of those adverts then.
So in that, for us, the health workers will know how, if you can't bring them on board, then the health workers are trained at AHF to bring them on board.
Wow, well, you can follow this conversation on our YouTube page, which is at U24 Television. You can also follow us on Facebook, and and you can have this conversation. Doctor, before we get done, I can see my producer coming in here. Someone has sent a message. This is Brenda saying, "Good morning, Sheila. Thank you so much for hosting Dr. Haruna. My question is, if I am a pregnant woman, can I be able to get STIs, as doctor has mentioned? If he could kindly let us know, and how do I go about it? Thank you for the show this morning."
Yeah, I think with all pregnant women in Uganda have antenatal, they should attend antenatal services from the different service points, and anybody is prone to getting STI. Anybody is prone to getting STI. So there's nobody who's not immune with STI, provided you go in a risk behavior aspect. Okay, either a husband or the wife, but when you get it, so even pregnant women do get STIs. And when they get it, the best thing in doing antenatal, the only things are being checked.
Yes.
So
true.
when you get it, you have to get treatment. You have to get treatment because STIs have very many complications to the mother and to the unborn baby. So you tell her that she should seek medical.
She's watching, actually. Yes.
Yeah, I think that she should seek medical attention advice from wherever she's getting antenatal.
All right. Good morning, Sheila. My name is Alex, and would love to ask the Dr. Haruna. I have a bit of, when I go to the toilet, I have a bit of pain when I'm urinating. Is it possible that I could be having an STI? Thank you for the show.
Yeah, burning sensations or painful mutilation, urinating, let's use the language she's trying to use. Burning, urinating, when you feel the burning sensation or painful mutilation, is a sign of an STI. It can be a sign of a UTI or a sign of STI. So what my advice for him is to go and have a checkup.
Okay, another one here comes in. Good morning, Sheila. Thank you so much for bringing in Doctor. We appreciate, and Doctor, thank you, for sparing your time to come through. I have a partner who is HIV positive, and I don't have, but we want to get a child. How do I go about that? My partner is so angry every time I talk about getting a baby because she thinks that the baby may acquire the disease. How do I go about that, Doctor? Is there any contact that you can read for us and we'll be able, to call, or I take her there so that we can seek advice?
Okay, thank you very much. I think that's a discounted couple. Because if the husband has HIV and then the wife doesn't have, then that is discordancy. So when the two want to get, if she wants to get pregnant, then my advice is that the things that she should want, I'm going to just explain a few things, but the key point, she should seek medical advice from the at clinics, okay? But there are nowadays what we call drugs that prevent from you get what? HIV, which you call PrEP. So there are drugs we can put her on. She can swallow, then she can have herself protected, then get her pregnant. And the baby will not get HIV. So my thing is, let us seek medical advice from the HIV specialist clinic. And we shall do the basics with you.
Okay.
Because there's protection, we'll have PrEP and PEP. PEP is where you get into a risk behavior, and then you can't swallow, then PrEP is when you want to get in I want to get a baby, but I fear to get infected, so there are drugs we give you.
Someone has sent a very interesting question. I feel offended, but anyway, he's a doctor. And good morning, Sheila. Thank you for bringing Dr. Haruna. My name is Philip. My question is, Doctor, do we still have PEP that gives people nightmares?
That's not PEP, but it is. There was a drug that we used to use to give people who are starting HIV, and basically it was called efavirenz. Okay, So it used to cause nightmares to
that sick
to
person.
some of the patients.
Patients,
okay?
true.
And with more modifications and more technology coming in the drug marketing aspect, such a drug has been removed from the ART market. So it's no longer in existence. Unless, but by Ministry of Health, we don't have it on market. So we don't give it a favors.
All right. Phyllis has said, Doctor, just in case I want to, okay, I don't understand this question. I'll come back to it. Someone has also said, are the drugs for syphilis or still that painful injection? Meanwhile, thanks for the lessons, Dr. Haruna.
Yeah, of course, we haven't changed the drug. It's the same drug we are using. But the only change we have said is we have looked at the staging of the syphilis, such that we no longer give the 3 injections which we used to give. So it depends on the stage of your syphilis that we treat you. And this is something the population should know, the people should know, that I may treat you for syphilis, like Sharon, you come, I treat you for syphilis. Then you don't expect, and when you do a repeat test after 2 weeks, you still have the inactive diagnosis of syphilis. So it will take you around what science says, you take around 2 to 3 years to do a repeat test of syphilis, so that you really get to know if that is a recurrent syphilis, okay? Then there are also other lab tests that we are now doing that can even tell that this is anode syphilis or this is a new infection. So basically that one you have to go into the laboratory to make a decision.
Okay, Phyllis was asking, I'm so sorry, Sheila. Doctor, I wanted to know that recently I got engaged in sexual intercourse with my husband, but I believe that he was cheating and I got a bit of an irritation and itching. Do I have to drag him to hospital to get tested for an STI?
I think she should first go for an STI screening herself. Then they do the test, but I would advise couple testing, which is very good. Okay, if you suspect risk behaviors into a marriage, then it should be more of a couple testing. And if you go and then they test you and then they see you are infected with an STI, then it is the mandate to go and inform your partner. And that's why I said the 3 W's, that when, where,
and how
is. I think
very
that's
important.
what she should do that.
Okay, there are very many questions, but I think we'll have Doctor. Someone has said if Doctor could talk about HIV, but allow us to end here. Doctor will come in. I think, Doctor, I should have you next week to come and talk about HIV. People here asking, how can we go about HIV? How do we prevent it from getting our children, our unborn children? And also, how can we, tell our partners to go and check? I think we'll have Doctor next week on Saturday to come and explain to us HIV and what is HIV in depth and the vaccines that are on the market and the drugs. Doctor, when you look into our cameras there, what will be your last remarks to the people watching and what could you tell them about STIs?
Okay, thank you very much, Sharon, for hosting me. And my advice to the people listening would be, and watching us, should be that STI does not discriminate. Anybody can get it at any time. But the key point is to know your status, how you're standing. And for us, AHF Uganda Cares, with those many things I've told about, Chitante, Kalunga, and St. Badikudembe, we are open and all services are free of charge. So they can come in and we shall.
Do we have a toll-free number?
Yeah, we'll share it with you.
Okay.
But we have all the staffs we are specialized. One of the things is that we have what you call timely aspects. You don't need to wait. Waiting time is not that much. And then you have all the services offered within that catchment area.
All right. Well, doctor, thank you so much for coming through, and thank you, for enlightening us about STIs. And we're surely going to have you next week so that we can talk about HIV, because I believe HIV and STI move hand in hand.
Yeah.
And we need to know about, HIV, the new vaccines that, Ministry of Health has on the market. And also you can tell us how can one prevent, themselves from engaging in getting HIV, and the use of condom, because people don't know these things. So we'll be glad to have you next week. But thank you for coming through. Send our regards to the management of Uganda Cares. And we as a team will come through one day to get checked, and we'll see if we are, on the same page as you've said here. Thank you so much for being part of this lovely show all the way from the hour of 9 up to this hour. DJ Shamo is here to, play for you the latest music, and of course, fresh and clean. You want to know any gossip that is happening? Well, just keep it locked to U24, and do not forget to follow us on TikTok. Now, we have been live on our TikTok page, which is at U24. You can go there and get to learn more about STIs. And if there's anything you need to know, we'll be giving out our numbers. You can call us. We'll have the doctor to come and explain more things about, STIs and HIV. So next week, we'll basically be talking about HIV. How can we prevent it, and how can the use of condom, prevent HIV? All that will be happening here on One-on-One on U24. I've been your host, Sheila Kahunde. Have yourselves a very, very lovely, lovely morning, and God bless you. Do not forget that we're in a period of fasting, so do not do anything that is against, the 10 commandments. And for the Muslims, we wish you a happy, fasting period, and with the Catholics as well, and the Christians all over. Thank you for watching. Be blessed. We'll do this again next time, same time.